Welcome to the recorded version of the Grantmakers in Aging web seminar, Elder Abuse, How Funders Can Make a Difference, featuring Laura Mosqueda, co-director of the Center of Excellence on Elder Abuse and Neglect at the University of California at Irvine, Mary Twomey, co-director of the Center of Excellence on Elder Abuse and Neglect at the University of California at Irvine, Laura Rath, Senior Program Officer of the Archstone Foundation, and John Feather, CEO of Grantmakers in Aging, from April 23, 2013. This event was made possible by a partnership between Grantmakers in Aging, the John A. Hartford Foundation, and the Archstone Foundation. Technical and production support is provided by the American Society on Aging.
Thank you, Steve. It's great to be here, and thanks for all of you who have taken time today to join us for this important topic. As Steve said, I am the CEO of Grantmakers in Aging, and we want to welcome you to this continuing series of monthly webinars on these critical topics. Before we begin, I want to thank two of our members for their support in making today's webinar available free of charge to funders in aging. The John A. Hartford Foundation of New York provides continuing funding for this series, and the Archstone Foundation of Long Beach, California is co-sponsoring this month's webinar. I also want to thank the expert team at the American Society on Aging for providing technical and production support for the series. Today's conversation with GIA turns to a subject that is always difficult, but we know that elder abuse is shockingly common. More than 4 million older adults are abused each year in the United States. Whether the form of abuse is defined as financial, physical, sexual, emotional, neglectful, or a combination of these, it is devastating for the victims and for those who love them. With growing knowledge about the aging process, systems of care, and healthcare reform, there is now an unprecedented opportunity to make a difference. We hope that today's session will help you as funders learn about the backdrop in which elder abuse occurs, and that you will be stimulated to think differently about how your priorities, present and future, directly and indirectly, can minimize this awful reality. Before we start, we want to ask you a couple of questions to see about your knowledge of this important topic. So, Steve, if you could bring up the first poll question, please. And that question is, for every case of elder abuse reported to authorities, how many go unreported? And the answers are 5, 10, 25, or 50. If you go ahead and make your selection. Well, actually, you're quite on the money. The answer is C. There's actually 23.5 unreported cases for every case that's reported. Let's have our second question then. What percentage of older persons with dementia are abused by family caregivers? And the choices are 5, 10, 25, or 50%. Well, it's actually a very difficult number because actually the percentage is 47%, or close to 50. 1 out of every 2 persons with dementia has some form of abuse by family caregivers, physical or financial or otherwise. So we are very pleased to have some of our nation's best experts to help guide us through this discussion. Dr. Laura Mosqueda and Mary Twomey are co-directors of the Center for Excellence on Elder Abuse and Neglect, and also the National Center on Elder Abuse, which are both at the University of California at Irvine. Dr. Mosqueda is also Chair of Family Medicine and Director of Geriatrics at UC Irvine School of Medicine. Laura Rath is Senior Program Officer at the Archstone Foundation in Long Beach, California, which has long supported efforts in elder abuse. As we go to the next slide, Laura Mosqueda, we'll start with you. This slide says we've come a long way on elder abuse. How so?
Well, we have come a long way in terms of some of what we know and understand. Starting back in the 70s, the first article about it was called Granny Battering. It was a British article, as you can probably tell by the title. And then the National Center on Elder Abuse was established in '89. And as Mary will talk about in a moment, there's a little bit gradually being more federal response. So while we have come a long way, I think the other important message is it's been way too slow and we haven't come long enough by any means. So even when we talk about things like federal response, as Mary will be covering, it's great that we're doing some work in this area. It's great that there's now some more science and research and education behind it, but it's totally inadequate in relation to the scope of the problem. It's a little bit like trying to carve Mount Rushmore with a spoon. And so we've come a long way, but we have a long way to go, and we need to move at a faster rate.
On the next slide, Mary, let's turn to you. Continuing with this timeline, how has the federal government played a role?
You know, I was not supposed to be a social worker. I was a history major and a theology major undergrad, and so I think that's why I think this context is so important. It's looking at the movement, the elder justice movement, in sort of a historical context. I feel like we were sort of wandering in the desert of family violence since this first article on granny battering appeared in 1975, but are coming in, we hope, a little bit into the promised land. In the last 2.5 years, there's been a lot of federal activity related to issues surrounding elder abuse and elder justice. So we have the very first ever piece of federal legislation related specifically to elder abuse, which was the Elder Justice Act, passed as part of the Affordable Care Act in 2010. Later, you can ask me how much money has been appropriated for that, but for now, we're still celebrating the fact that it was passed. In 2011, the establishment of the Consumer Financial Protection Bureau, which has a very robust unit specifically targeting older Americans, financial abuse and exploitation of older Americans. Last year, we had the pleasure of going to the White House to celebrate World Elder Abuse Awareness Day, and the first proclamation by a president recognizing World Elder Abuse Awareness Day, which was actually also recognized by the UN as an international day. So it's fitting that this year in June 2013, we will all be gathering at the United Nations with folks from all over the world who do elder abuse prevention and elder justice work. Just within this last couple months, the CMS is looking carefully at how do we incentivize physicians to detect and code elder abuse in clinical practice, and importantly, how do we reimburse them for the time that it takes them to do that important gatekeeping role. And just last week, a really amazing gathering of researchers in the field of elder abuse at a 2-day global forum on elder abuse held by the Institute on Medicine.
Wonderful. And we move to the next slide. It appears that the federal government is finally willing to show their commitment with funding. Is this a new development?
Well, as you can see from the slide that Laura talked about, there was an RFP, a request for proposals for research from the National Institutes on Aging, starting initially in 2005. But I would say that in the last couple years, again, we've seen a lot more, not only federal activity, but federal commitment to dollars. Now, it's really important to note that the funding is really disproportionate as to our brothers and sisters in our analogous fields, that is child abuse and domestic violence. At the federal level, about $6 billion is allocated annually to child abuse and about $650 million to domestic violence. And all the number crunching that we've been able to do and working with other policymakers, it's still a very small amount, around less than $20 million at the federal level for elder abuse, but it's important to note that a lot of that $20 million has been dedicated in the last couple of years, and so we see recently, last year, the Health and Human Services Department allocated $5 million and distributed $1 million each to 5 different locations around the country to specifically do research on prevention and intervention in elder abuse. The Department of Justice has an RFP, a request for proposals, out right now for research on abuse of elders and abuse of people in long-term care. There is we just learned last week that there's another $2 million that will be allocated for research and programming from the Department of Health and Human Services. And, it was only the first presidential budget that had any money in it for elder abuse was in this Obama administration. So this is the third year, and the dollar amount keeps going up. So we have the ask on the table in the president's budget is $8 million this year, which is really good.
That is great. As we go to the next slide, we'll return back to Laura and ask, how is the growth of the aging population in general affecting elder abuse?
Well, the important take-home really from this slide is to pay attention to the right-hand side of the graph where you look at just exponential growth of people over the age of 65. And the fastest-growing segment of population are people over the age of 85. I'll come back to this in a few slides, so I'd like for people to remember this sort of general trend. The important piece here is that as we grow older, vulnerabilities to elder abuse increase. That's why we have a category of elder abuse, so that as people particularly get into their 80s, 90s, 100s, is when you are dealing with folks who have more physical and cognitive problems that make them more likely to be victimized. And because this is the fastest growing segment of our population, it means the most vulnerable members of our society to elder abuse are the ones who are growing very rapidly here.
Okay. Then in the next slide, let's turn to the scope of this issue. And then if we can move on to the next slide, what is our best estimate of the number of older persons who suffer abuse in the United States each year?
Well, at the very most conservative, you're looking at 2 million. 5 million, even that is probably an underestimate of people who've been victimized in the past year. As you can imagine, research on this is fairly difficult. You can't just knock on a door and ask if anybody's abusing grandma. And contrary to what many people think, the majority of abuse is occurring in the community by family members, not in nursing homes by paid caregivers. So while abuse is occurring across all settings, across all ethnicities, all socioeconomic strata, we have to pay attention everywhere. It's not just a problem in a facility. So it's common, and as we've seen with that last slide, it's going to be growing in importance and relevance to our country.
As we move to the next slide then, we know that elder abuse is underreported, as you talk about. Do we have any idea of the true number of cases?
Well, the question is, for every case that's reported, how many go unreported? There were numbers as low as 5, but we're really finding that is not the case. And the best study done on this was done recently by a group in New York at Cornell, headed up by Mark Lax. Using very good methods, they found that for every report, close to 24 go unreported. And that's the tip of the iceberg sort of phenomenon with this.
That's really a staggering number. As we go to the next one.
And I'm sorry, but before we go to the next one, or I don't know if it's possible to go backwards on this, one comment to be made is when we talk about abuse and that graph we had earlier that showed a map of the United States, and the studies that are done, the one this is quoted from, used a telephone survey method. It excluded people over the age of 85. It excluded people with dementia. So when you see some of these estimates, even though they're very good studies, when they claim to be national estimates, we need to remember that they actually don't include the folks in whom the most abuse is probably occurring, and that's people over the age of 85 and people with dementia. Now we can go to the next slide. Sorry.
And once again, what's our best estimate of abuse among people with dementia?
So now, yeah, that's what we're getting to here. So everybody remembers that graph from a couple slides ago, looking at that rapidly increasing number of people over the age of 65, and particularly people over the age of 85. About half of people over the age of 85 have a dementia. So large numbers of folks, and about half of people with a dementia are abused. And we talk about different types of abuse, and I don't want people to think when we're talking about emotional abuse, it's just that every now and again somebody throws an insult at an older person with Alzheimer's disease. The studies that have been done on this, one of which came out of our shop at UC Irvine, really were looking at pervasive, horrible sorts of emotional abuse that were going on. And then we also looked at physical abuse, neglect, and other types of abuse. So it's very common.
Before we move to our next slide, I want to remind our audience that you can ask questions at any time. There's a box on your screen, and you just type the questions in, and I will be relaying those to our speakers later on as we enter the question and answer period. So, Mary, let's come back to you. And at this point, and we look at the next slide, let's talk about the impact of these numbers. Tell us a little bit about the impact of elder abuse.
Well, you know, it's interesting because the word impact to me I usually hear it used in conjunction with something that's crashed into something else. You know, there's been so much interest in concussions, for example, in younger athletes. So I think of impact and physical abuse, which I think maybe I'll just take a moment to say that the different kinds of abuse that we are talking about include physical abuse, but also emotional or psychological abuse, you know, financial abuse, sexual abuse, and neglect. And what's interesting about the impact of elder abuse on individuals is it doesn't seem to matter what kind of abuse it is or really how severe the abuse is, just the fact that abuse has occurred. And interestingly, if we look at sort of the cultural nuances of elder abuse, if you ask older Asian Pacific Islanders in focus groups that were done by researchers, they indicate that the kind of abuse that hurts them the most is actually emotional abuse. And I have seen in my own practice older Asians who were so devastated by the emotional abuse that they just never really recovered. So we're talking about victims who are twice as likely to be hospitalized, 4 times as likely to be placed in nursing homes, and interesting, and you know, most tragically, 3 times more likely to die. So we're not talking about just physical abuse. This is not that somebody has been really hurt physically and therefore died as a result of that. This is any kind of abuse, really any kind of level of severity. And so the impact on individuals is lethal and tragic, but it also has an impact on the rest of us because as people are going into these kinds of situations, they are costing our society money, as much as $5 billion a year lost because of elder abuse to the healthcare system. And then seniors themselves. Yeah, go ahead.
Oh, sorry. I was just going to add one thing in to that, and this is Laura Mosqueda adding in the fact when Mary talks about the fact that people are more likely to die related to having been abused, it also, to me, brings up some of the ageist attitudes that we're dealing with because it is not uncommon for us to hear people make comments, be they people in healthcare, law enforcement, social services, that, well, they're old anyway, so they were going to die. And I think that that's one reason the whole aging issue makes people less likely to be interested in elder abuse, and people are dying under really horrendous circumstances sometimes, yet getting people to care about it and realize that just because you're 90 doesn't mean you're supposed to die tomorrow is a challenge that we face.
Indeed it is. And let's move on then to a quote from one of our esteemed colleagues. Many of us know M.T. Connolly, who received a MacArthur Genius Award grant for her work in elder justice, and her quote's on the next slide.
And I agree with Laura completely, and I think if MT were on the call with us today, that she would agree that one of the reasons that this issue that affects so many people has received so little attention is actually the ageist bent of our society.
So if we go on to the next slide now, let's turn to the opportunities that funders have to make a different kind of impact, a positive impact in the lives of older Americans. So if we turn to the next slide, Mary, what are some ways that funders can target their efforts?
We wanted to sort of set the issue of elder abuse a little bit into the sort of public health context. So we're looking at what are some of the ways that what opportunities are provided to funders to make a difference at the primary level where we're really trying to prevent elder abuse or detect it early enough to mitigate its significant impact? Where do funders have the opportunity to intervene in that secondary level when abuse has already occurred and provide services to victims, services to those who are supporting victims, and then a tertiary response, really responding to the problem at a higher level for long-term impact.
Okay. On the next slide, obviously preventing elder abuse is a much desired outcome. What kinds of programs have been shown to help in the prevention of abuse?
So obviously, yes, this is the thing that we would all like to do, is to be able to prevent abuse. So a couple of the things that research has shown help in this area is to educate folks, through in-person education, or also through, to a certain degree, public awareness, to educate older adults themselves on the warning signs of abuse and how to prevent becoming a victim of abuse, but also, very importantly, in all of the folks who are working with older adults, whether they're bankers or clergy or attorneys, how do we make sure that those professionals are educated so they are helping people to plan ahead to protect themselves from becoming abuse victims, or to detect abuse in its earliest stages so they can mitigate the impact. One of the research projects that UCI is working on right now is taking some of the good work that's been done in looking at how do we screen for abuse, how do we identify people, whether they're individuals or in maybe caregiving pairs, caregiving dyads, where we're recognizing that those folks are at high risk. This is good work that's been done in child abuse, identifying families that are at high risk of perpetuating or perpetrating child abuse and putting supports around them and targeted interventions so that that abuse doesn't occur. And similarly, how can we could do that with programs that provide care, that provide support for caregivers. And then continuing to the next slide.
And I'll just mention, if you don't mind me chiming in here, Mary.
Not at all.
This is Laura, that if people are interested later, just as a geriatrician who sees patients, if there's interest, we can talk later. I really have changed the way I practice as a result of my experience in the work I've done in elder abuse. It really has changed the way I practice medicine. So if there's interest, we can talk a little bit more about that later, too.
If we could go on to the next slide, and Mary, keep going.
No, I was just going to say that I know one of the things that MT Conley talks to people about a lot, and I really feel strongly that folks can plan ahead to prevent abuse. And so funders could be looking at, how do we do that? How do we help attorneys know how to do that, provide legal assistance for folks and financial assistance for folks to be able to plan ahead? And then, of course, because we are a university, we're always then looking at what kind of research needs to be done so that we can know more what helps to prevent abuse, what are the risk factors, including what are the risk factors and protective factors related to culture. There's been some good studies, a study recently in the last year looking at the high incidence of elder abuse in the immigrant Latino population that found very high rates of elder abuse in that population, but not enough has been done looking at cultural and minority groups. And then finally, just also, how do we implement policies like mandating screening in various places or mandating training of important gatekeepers? All of these would go very far to help prevent elder abuse.
On the next slide, we'll come back to you, Laura. When elders are abused, what kinds of programs or services have been shown to alleviate their suffering or increase the efficacy of the community's response to this issue?
Well, we know that some direct services are really important and useful, like counseling. There are some emergency shelters around, but, they bring up interesting issues. A lot of emergency shelters, for example, for victims of domestic violence, aren't equipped to handle people who are in wheelchairs or people with Parkinson's disease, people who need medications. So there's interesting challenges with all of these different sorts of direct services. There's interesting work being done with some specialized courts for older adults, transportation, legal services are really important. And as many people know, legal aid is severely underfunded in all communities. I think we have some more intervention efforts on the next slide as well.
So if we could turn to the next slide.
It's clear elder abuse is so doggone complicated. It really requires a village. So multidisciplinary teams are absolutely the way to go. We know that partly because without any funding, they spring up in places where people are struggling and want to do the best job they can. So despite the fact that people have very little, if any, funding, teams are coming together and trying to address this issue. Some of them specialize in financial abuse. Some of them are more general. There are a number of elder abuse forensic centers around the country now that was really started with funding from the Archstone Foundation. A nice example of how a model at a local level provided for by a foundation has spread nationally. And then there's a lot of interest in telehealth. So how is it that if you have the expertise at a local level, you can be made available more widely? There are a number of efforts at the level of the justice system, elder courts, as I mentioned, different sorts of prosecution units, and some service units that are forming. There are family justice centers around the country, but very few of them pay a lot of attention to elder abuse. But we have opportunities for coordinated care, clearly. And then some programs that are really specifically focusing on late life domestic violence.
Thank you. If we move to the next slide, Mary, let's bring you back in once again. How can we ensure that funders' efforts have a long-term impact?
Well, when we think about the sort of public health model and the tertiary response, we're looking for is programs that reduce recidivism, that help the client to recover fully and not be victimized again. And so long-term impact for the client, I think, is, housing, counseling, home care services, legal services, some of which also help prevent elder abuse from occurring, but this is sort of after the abuse has occurred and this client is now recovering. These are really important for clients' long-term health. But also, if we want to have a long-term impact on the system, I'm not sure how many people on the line are familiar with elder death review teams. Elder death review teams are analogous to child death review teams and domestic violence death review teams that have existed for 20 years or so, where the approach is to look at someone who basically the system did not work correctly in that person's case. And then what we want to do is use that person's in many cases, a suspicious death or a death that has been known to be caused by abuse or neglect, and go back and fix the system so that that doesn't happen to another person. And so there, I think, are opportunities for looking at system work through the elder death model. Also, of course, research, what is working in our field. We know not enough yet, but there are so many promising practices like forensic centers and others that we want to be able to show folks that why these are working, how we know they're working, so they can be replicated. And then finally, I think for long-term impact, we really want to be looking also always at how do we channel on an advocacy level, how do we channel the voices of regular everyday people who care very desperately about this issue. And what's been interesting to me when we started Ageless Alliance, which is a group we started at UC Irvine through our Center of Excellence on Elder Abuse and Neglect, it was really born out of, all of us receiving calls from people who cared very much about the issue, sometimes because they had had a personal encounter with the issue, a parent, a grandparent, another relative who had been neglected or abused or financially exploited, but sometimes just because they were people who really cared about the issue and had no personal connection. And to a person, everyone wanted to do something, one, to help make sure that nobody else went through the same very painful experience that they went through, and just to make a difference in making our society a better place for older people for people to grow old. And so we now have Ageless Alliance, which is a place that we're funneling people to so they can take action on behalf of older victims, and older victims themselves joining to tell their stories and to help others not be abused. So those, I think, are some investment opportunities for the long-term impact.
As we move to our next slide then, some people and certainly some funders feel that this is an area that is so enormous that their contributions may not have any impact. Do you feel that's true?
No, I don't. And I think we have great examples of this is not just a matter of a drop in an ocean, but that really funders can make a huge difference. Again, I think Laura Rath will be talking about it, but when you look at I think you can trace back what's happening at the federal level directly back to Archstone Foundation and what they were doing 15 years ago. I think it's a matter of hanging in there and understanding a return on investment might not come in a year or 2 years. It might take a while, and you've got to hang in there with it. And it's not just amount of money spent and amount of money saved, or it's also the amount of money spent and the number of people affected, and then multiplier effects. Obviously, I'm biased because I'm in an academic institution, but if I train a physician on detection of elder abuse, then the thousands of patients that physician will see will all benefit from that training. If I now also train one of our faculty members, they are going to now go on and train every medical student who comes through, and will be affecting not thousands of patients, but hundreds of thousands of patients. So there's also this opportunity for a multiplier effect, I think, in certain educational institutions as well. But we've got to have some good science behind us as well in order to invest in a really thoughtful and appropriate way.
Our next slide has the contact information for the centers and for the Ageless Alliance. We want to thank Laura and Mary for this excellent overview of the issue. At this point, as we move on to the next slide, I want to bring in Laura Rath from the Archstone Foundation and to give us a funder's perspective on how funders can help in this critical area. And on the next slide, Laura, does this issue affect funders that focus on healthy aging?
Thanks, John. And first, I just wanted to give a word of thanks to Grantmakers in Aging for hosting us on today's webinar and for bringing attention to this important issue. I look forward to sharing some practical ways in which other funders may incorporate strategies to address elder abuse, and also to briefly sharing the approach taken by the Archstone Foundation. So I hope that the presentation from Dr. Laura Mosqueda and Mary Twomey has helped you to understand the scope of the problem of elder abuse and neglect, and to think about some ways in which funders can address the issue at any level of funding. To your question, John, for foundations and programs that promote healthy aging, I think the most important takeaway message is that elder abuse undermines healthy aging. The average victim of elder abuse is an older woman who lives alone, and half of women age 75 and above live alone. Therefore, if you are working with older adults, then unfortunately the answer is yes to that first question that was posed here by Kathy Greenlee, which is, are the people we see suffering abuse? And unfortunately, as I said, the answer is yes. And in fact, as we heard from Dr. Mosqueda and Mary, about 1 in 10 older adults will likely be the victim of elder abuse. And I think that leads to the next two questions. Do we know who those people are, and what do they need from us? And I think the next slides will explore those issues.
So if we could move to the next slide then, can funders address elder abuse through their existing focus and programs?
Yes, absolutely. I think elder abuse is a problem we can address, but it will take thoughtful, coordinated efforts to do so. And here are some examples of programs that foundations may currently support that I think could be enhanced to include an approach to preventing elder abuse. First, transportation. We know that isolated elders are more likely to be the victims of abuse. Therefore, older adults that friendly and accessible transportation, as well as increased social connections, I think may serve as a protective factor against abuse. We also heard that caregivers will speak about the issue if they are asked. Also, older adults with dementia are more likely to be abused. And as we heard from UC Irvine in the first half of the presentation, 1 in 2 people with dementia are likely to be abused by their family caregivers. Then just as child abuse is included in professional training for health professionals, so too should elder abuse. Family practice physicians, nurses, dentists, occupational therapists, just to name a few, need to be trained to recognize and report cases of abuse. And finally, if you do work in faith communities, that could also be a great source of people who would be well-positioned to potentially identify and provide counsel to victims of abuse. So I think if your foundation is doing work in any of these areas, I would challenge you to consider adding an elder abuse component to those programs.
As we go to the next slide, tell us something about the approach taken by the Archstone Foundation. Why have you invested in this topic?
Great. So the Archstone Foundation is a private grant-making organization whose mission is to contribute toward the preparation of society in meeting the needs of an aging population. We're located in Long Beach, California, and annually the foundation awards approximately $5 million.
Go ahead. Go on to the next slide, please.
Thanks, John. So I think the foundation really recognized that elder abuse is a terrible epidemic facing our older adult population. And with that, the foundation launched an initiative in 2005 with the goal of improving the quality and coordination of elder abuse and neglect services in the state of California. The criteria for selecting elder abuse as a focus area were, 1, the foundation's past history with the topic area, 2, that the foundation posed a significant problem to society, and 3, that the problem really required outside resources in order to move the field forward. During the course of the initiative, the Archstone Foundation awarded over $8.5 million to 22 projects, which lasted from 2006 until 2010.
Go on to the next slide then. What types of projects were funded by the Archstone Foundation?
So as you can see here, projects included support for forensic centers, multidisciplinary teams, education and training of mandated reporters, and financial protection projects, among others. And you heard Dr. Mosqueda and Mary speak about some of those types of programs during their presentation. Convening, technical assistance, and evaluation were also integral parts of the design of the initiative. And although the Archstone Foundation invested in an initiative-based approach, individual projects like support for an education and training program or a multidisciplinary team can still serve to have a significant impact at a local level. And integrating elder abuse into existing programs, such as those transportation or caregiving programs, I think can also greatly improve the lives of older adults by keeping them safe and free from abuse.
Go to the next slide then. What are some of the key lessons that you learned from this initiative?
Absolutely. So I think some of the lessons learned were to make a commitment to strategic grant making. So in order to change the culture around the way elder abuse is perceived in our society and to develop the lasting systems to respond to the crisis, there needs to be a long-term, multi-year investment in the issue. Second, encourage innovation in your grant making. I think each community will have unique approaches to providing quality services. Using a general format and a common core elements, such as a multidisciplinary team, encourage individual communities to create a structure that will best serve that community's needs and optimize services for victims. And finally, leverage resources. In total, for every dollar that the Archstone Foundation invested, an additional $1.93, so almost an additional $2 was leveraged. And we believe that because there's still so much need in the field of elder abuse, funders will likely see a large return on their investment if they choose to support programs that address this issue.
Wonderful. The next slide, if you want to continue on, any final comments about the initiative?
Thanks. I just wanted to mention that the full lessons learned and description of the initiative is included in a report released by the Archstone Foundation, and we'd be happy to share that with anyone who's interested, and it's also available on the Archstone Foundation website.
Great. Our final slide then has the contact information for the Archstone Foundation, and as well as the fact that you can have these slides if you send a note into the ASA site that you signed in on. I want to remind our audience that we're now going to move to questions and answers with our panelists. You can send in your written questions in the box that's on your screen, and I will be reading them to the panelists. So I will start with the questions, and I will send this question first to Laura Mosqueda, but then I'll ask our other panelists as well. If a funder has limited amounts of money, say $100,000, to support elder abuse interventions, what phase would be the smartest to invest in? The prevention of elder abuse or intervention after it's occurred?
Well, I think it could go either. You could do a huge amount with $100,000 in either phase. I would say intervention. Each one of those areas is in a different stage of evolution. I think prevention is at an earlier stage of understanding and evolution than is intervention. So you could have fantastic investments, I would say, in either one of those. I wouldn't give preference to one over the other. I would do whatever aligns with that foundation's goals, and then also see. I'm a big believer in looking at the low-hanging fruit, and so if you have, if you're, say, doing this at a local level, and there's a group who already has particular expertise or ability in either prevention or intervention, this is the kind of shot in the arm that could take them to a whole new level with a project.
That's great. Mary or Laura, anything to add?
I was just going to, this is Mary, I was going to say that some sort of assessment of what the strengths are of the local community would help you, I think, direct the funding in the right direction.
Okay.
And this is Laura Rath. I would, of course, echo the comments of the other two presenters and add that in some of those cases, perhaps a multidisciplinary team approach might address both of those sides in terms of being able to provide some education as well as intervening in cases of known abuse, just as one example.
Okay. The next question is about abuse of women, and you mentioned in the presentation that women are more likely to be abused than men. Is there a specific focus on the needs of women as part of this work? Is there appropriate research being done or programs targeted for women? And in what ways do you feel in your practice in the clinical setting or in the legal setting that men and women are different in their needs in this arena? And I'll send that one to Mary first.
Yeah, I'll jump in. It's a really, really great question, and I just would say on a personal level, I don't feel like elder abuse has done enough yet I don't think it has yet leveraged all of the interest on behalf of the women's community and especially the violence against women community. So the research shows that in the reports made, about two-thirds of those reports, the victim is a woman. And I think women generally have higher rates of violence than are victimized at higher rates than men. I would probably ask Laura to turn to the sort of clinical issues related to women and aging and their vulnerabilities, but I think that there is a lot that we could be doing to focus on the needs of older women and especially their violence, the tendency that they have to be victims of violence. I did some number crunching not long ago looking at the census, the most recent census, the 2010 census, and if you take 55 as the triggering age, 1 in 3 females in this country is 55 years of age or older. Recently, this is my little anecdote of the day, last year Red Book put out a solicitation for stories about violence against women, and they asked for stories. They wanted stories from the women who had been victims of domestic violence or teen dating violence. And the cutoff age that they put, they wanted stories from people between the ages of 18 and 49.
Right.
So, Laura, I didn't know if you wanted to answer parts of that.
Yep, I'll answer it in two ways. One is we know that women are victimized at higher rates. We know there are more women with dementia than men with dementia, probably because women live longer, and so it's a women's issue in that sense. It also is a woman's issue in that most caregivers are women, and I think we need to look at programs that not only focus on the victim, but also focus on the people who are doing the abuse. And I do have some disagreements with the domestic violence community in the sense that I don't think that all of the people who end up abusing are bad people. I think a lot of them are completely overwhelmed and stressed caregivers who need help. And this is my great hope when it comes to early intervention and prevention. In no way does being overwhelmed or stressed forgive or excuse abusive behavior, but it does help me understand it so that we're able to intervene and prevent.
Thanks. This question is for Laura Rath. You mentioned in your presentation that elder abuse interventions can be integrated into other aging initiatives that are already ongoing. Can you explain this a little more? For example, if this foundation is funding a transportation program for older people, how could it be expanded to include an elder abuse component?
Well, I think this is an area where research is emerging, and I would also like to get the feedback from Dr. Mosqueda and Mary as well. But in terms of expanding, I think you could work with current projects or grantees to see if they might be able to add an educational component to what they're doing. Now, in the case of transportation, this is something that was discussed last week at the Institute of Medicine's workshop on elder abuse and its prevention that Mary Twomey mentioned during her presentation. And Dr. Ron Oscierno had mentioned that because isolation is such a risk factor for abuse, and although we need more research about it, he suggested that one community intervention might be providing those transportation links so that older adults don't end up isolated and in their homes where abuse could be a hidden problem, but where older adults are able to make appointments to their physicians and to their doctors. And maybe that's a good opportunity for me to ask if Dr. Mosqueda has anything to add.
Yeah, I mean, just to riff off of that for a minute, the other piece is if you're working with a transportation group, teach them what to look for that might indicate that this person is at risk or is being abused. Because, you know, sometimes older adults will form very close relationships with drivers who they get to know over time, and these folks need to know what to do when they have concerns, or if somebody keeps missing appointments who used to always keep appointments, for them to have this on their radar as a possibility. So I think no matter what other kind of program you're looking at, if it's a program to help relieve caregiver stress, put an elder abuse component in it. If it has to do with diagnosis and treatment of people who have dementia, put an elder abuse component in it. It might be an educational component, it might be a program component, might be a research component, but almost anything that has to do with aging has that opportunity.
Mary, I'll send the next question to you, and the question is, are there evidence-based models of elder abuse programs and interventions? Do we know enough, I think is another way of putting this, to be able to move forward with confidence that programs that we're creating will be successful?
You know, I think the short answer is it's a work in progress, and I think we have research on certain kinds of interventions, and it's a growing body of knowledge. So that's probably a pitch for more funding for program evaluation and research as to efficacy and other goals. But when it comes to things like research, I'm punting this quickly to Dr. Mosqueda.
Well, I mean, this is I think a nice example of why it takes a team, is we help each other out with these sorts of things. And I think we have to have a two-pronged approach. One is we are sorely lacking in good research. There's plenty of research that isn't so good out there, and you need to be careful about the conclusions drawn from that. However, we don't have time to wait for the placebo-controlled, double-blind, randomized controlled study to know that there's a big problem out there and people are dying and suffering. And we need to do something that's at least thoughtful and passes the common sense test while we are also doing the research and waiting for those results. So you got to do both at the same time.
Right. Mary, this one will come to you, and I'll ask all of our panelists to respond. This will be our last question because I want to give you all an opportunity to give us your final comments. But you mentioned promising new practices, for example, the forensic centers and so forth. Can you expand a little bit on this? What are some of those promising practices that have already been developed and proven to be effective?
Well, the forensic centers is a really good example. There was a study published, I think, last year in the American Geriatric Society's publications looking at the impact of cases going through the forensic center versus cases that didn't go through the forensic center. And the cases that went through the forensic center were 10 times more likely to be prosecuted, and that was the goal of that forensic center in Los Angeles, that they wanted to be able to prosecute cases. So that was a very good goal. This is, again, it's not unlike the question that Laura just answered. What do we know works, and what are some of the other promising practices? It might be better for this. Again, I'm going to ask Laura to chime in, but we could also send the requester some materials that we have on this, where I would be happy to pull together some of the research.
Okay. And people can do that. If you respond in the question box and ask for additional materials, we'll make sure that they get to you. At this point, I want to ask our presenters to give us their final thoughts about this critical topic. We are so pleased that they are so committed to this effort. Dr. Mosqueda, let's start with you. Dr. Mosqueda?
Oh, sorry, didn't realize I was on mute. I just said something so brilliant you missed it, and I'll never capture it again. Mary's laughing because she knows I never say anything brilliant. The one thing I think we haven't touched on is I think, critically important interactions that need to be nurtured between the medical, social service, and criminal justice systems. There tends to be focus on certain topics, but not on this more broad-based sense of an interdisciplinary team. And it is so clear to me around the country that there are just pockets of expertise in some of these different areas. I would love to see ways to start bringing together these different systems in a more thoughtful manner, such that we're learning from each other, and as well as learning from the fields of child abuse and domestic violence.
Mary?
So I wanted to just tell everybody a story. There's some really good work being done in elder abuse in the faith community out of a group called Safe Havens in Boston. And a few years ago, the woman who directs that program asked to be put on the National Center listserv, because she didn't know this, but twice a week we send out news feeds, a news feed which is stories pulled from the headlines that have something to do with elder abuse. And there would typically be 20 stories each time we send it, plus stories from international, plus stories related to abuse of people with disabilities. And when she first received it, she thought that I was sending her the year's stories. And so she wrote back, she said, "Thanks for pulling that together for me." And I was curious, like, what does she mean pulling it together? And so, of course, she received another one on Thursday. And then she received another one the following Tuesday and another one the following Thursday. And then she said, "Oh, I had no idea that there were so many stories of elder abuse that you can send me basically 40 ripped from the headlines a week." And I think she was already committed to the issue, and especially her particular interest in working with clergy, but it was overwhelming to her, and I wanted to invite anyone on the call who's interested in being on the National Center on Elder Abuse listserv, which we run out of the program in geriatrics at UC Irvine, to see those. I think they're very impactful, and they give you a sense of what's happening in your community related to elder abuse. And I thought I would end again with our good friend M.T. Connolly, who I used to quote, all sorts of poets and things, but now I just quote M.T. because she said, like a domino toppling, elder abuse can cause a cascade of consequences with implications for the health and economic security of the victim, his or her family, community, and nation. And I thought she said that very well.
Thank you. Laura Rath?
Thanks. So I'll end with a challenge, and that is start small, but I think in this case there are no small deeds. In a field that has been so neglected, so hidden, and yet has so much need, even small contributions will have a large impact. So as we leave, I would ask you to think of one thing that you could do to address this issue.
I want to thank Dr. Laura Mosqueda and Mary Twomey, the co-directors of the Center of Excellence on Elder Abuse and Neglect and the National Center on Elder Abuse, both at UC Irvine, as well as Laura Rath of the Archstone Foundation for their participation in today's program. Thank you all for everything you do to make life better for America's older adults. I also want to thank the John A. Hartford Foundation and the Archstone Foundation for their support of today's program, as well as the expert team at the American Society on Aging for their technical expertise. And finally, I want to thank each and every one of you for participating in today's webinar. Have a great day.